Actually, the Petrous bone is considered one of the interesting parts in the human body, especially whenever we are dealing with the anatomy. And after that, we'll deal with the pathology. And we'll start first by the technique of examination used to assess the Petrous bone by CT. Then we should examine the Petrous bone in the spine and the prone position in the axial and the coronal plane. In the axial plane, we start from the base of the Petrous bone and proceed upward until we finish the apex of the Petrous bone. And this is the axial image. And in the coronal image, we proceed from backward to forward, considering the area of the Petrous bone, which are superimposed on each other in this lateral scangram. Then this is the coronal image. We usually scan the Petrous bone every 2 millimeter slice thickness, and we use the suitable field of view so that the whole Petrous bone can be seen in the images. The patient position should be symmetric as much as we can, and the role of contrast injection will be discussed during the part of the pathology. Then in order to understand the anatomy of the Petrous bone, we divide this area into 3 parts. Anatomically, the external ear, the middle ear, and the inner ear. And if you look to this drawing, you can see the external ear is just like a tube, and this tube is composed of a cartilaginous part and a bony part, and this tube connects the area outside the eardrum to the external environment, and this external ear ends by the tympanic membrane. Then behind the tympanic membrane, you can see the structures of the middle ear cavity where the ossicles are seen, and you can also identify this canal, which is the canal for the tensor tympani muscle. This canal is separated from the Eustachian tube by a small bony ridge, as you can see. Then you know that the middle ear cavity is connected to the nasopharynx through the Eustachian tube. Then if you look to the external ear by the CT scan, you can see this airway, which represents the external auditory canal. Partly it is cartilaginous and partly it is bony. Then the external auditory canal ends by the region of the tympanic membrane, which can be identified by these 2 small bony projections. The upper one is known as the scutum, and this bony projections as a whole are known as the tympanic annulus. Then the external ear is filled with air. Sometimes you can see a small soft tissue inside the external ear, which represents the ear wax and nothing else. Then you came to the middle ear, and the middle ear is the area which is behind the drum, and this is the middle ear cavity where you can see the ossicles, and also you can see the connection of the middle ear to the nasopharynx through the Eustachian tube. The ossicles include the incus, the malleus, and the stapes. And inside the middle ear cavity, you can also there are also some muscles and nerves. These cannot be identified on the basis of imaging. Then you know that the middle ear cavity is connected to many structures, connected to the nasopharynx through the Eustachian tube, connected to the mastoid antrum through the adductus ad antrum, connected to the vestibule through the oval window, which is blocked by the footplate of the stapes, and connected to the cochlea through the round window. We'll see these anatomic structures on imaging. In order to understand the anatomy of the middle ear, we should have an anatomic landmark. And this anatomic landmark is known as the ice cream cone. This ice cream cone is formed whenever you are cutting this part of the ossicles, where the incus forms the cone, and the head of the malleus forms the ice cream itself. Then if you look inside the Petrous bone looking for the ice cream cone, then you can easily identify this ice cream cone. Then you know that this small part of the ice cream is the head of the malleus, and the cone represents the incus and its short process, where this is known as the longer process of the incus, and this is the shorter process of the incus. Then between the incus and the malleus there is a joint, and this joint is known as the oncodo-malleal joint, and it can also be easily identified in the image. Then these ossicles are present in the middle ear cavity, and this middle ear cavity is connected to the largest mastoid ear cell, which is known as the mastoid antrum. Then this connection, or this narrow track, is known as the adductus ad antrum. Then whenever you identify the ice cream cone, you can easily see the head of the malleus, the incus, the oncodo-malleal joint, the middle ear cavity, the adductus ad antrum, as well as the mastoid antrum, and these are the mastoid ear cells. Then if you look here looking for the ice cream cone, you can easily see the ice cream cone, and also you can easily see the ice cream cone here, and you can identify all the anatomic details we have. Then in the ice cream cone is located in the middle ear cavity. You can identify the ice cream cone. You can see the incus, the malleus, the adductus ad antrum, the mastoid antrum, which is the largest mastoid ear cell, and the oncodo-malleal joint, and this is the oncodo-malleal joint. Then what happens if you look below the level of the ice cream cone? You remember we are cutting here, but if you look to the section below the level of the ice cream cone, then you are cutting in the handle of the malleus and in the longer process of the incus. Then if you look at this Petrous bone, you can see two dots. The anterior one is the handle of the malleus, and the posterior one is the longer process of the incus. At that level, you can easily see the connection of the middle ear cavity to the nasopharynx via the Eustachian tube. Then, if you look carefully, you can see in this section, you can see the anteriorly located bone, which represents the handle of the malleus. The posteriorly located one is the longer process of the incus. And if you follow the longer process of the incus, you can see the crura of the stapes. And here, if you look carefully, you can easily identify the crura of the stapes. Then you know that this area will represent the oval window. But this is not the optimal position to evaluate the oval window, which is easily evaluated in the coronal images, as I will show you to. Then you should remember that at this level you are faced with this C line, and you can see the almost simulation between both. This is the head and the mouth of the C line, which represents the Eustachian tube connecting the middle ear cavity to the nasopharynx. And you remember, in this particular area, there is a bony ridge which separates the canal for the tensor tympani muscle from the Eustachian tube. Sometimes you can see this anatomic detail, sometimes you cannot see. Then in this area, you should see the two dots, which represents the handle of the malleus and the longer process of the incus. Actually, you can also see this very characteristic configuration where you can see two depressions and one elevation. The elevation is known as the tympanic pyramid. The two depressions, the medial one is the sinus tympani, the lateral one is the facial recess. The medial one is the sinus tympani, the lateral one is the facial recess. Then you can see here in this section the sinus tympani, the facial recess, the tympanic pyramid, which is the bony elevation, the Eustachian tube, which connects the middle ear cavity to the nasopharynx, and you can also see the mastoid. Then if you look carefully here, At that level, you can see the ice cream cone. And you can see the middle ear cavity, adductus ad antrum, and the mastoid antrum. Below this level, you will see the two dots. The anterior one represents the handle of the malleus. The posterior one represents the longer process of the incus. Then you can see the foot of the C-line. You can see the medial depression, which represents the sinus tympani, the lateral depression, which represents the facial recess, and the bony elevation in between, which represents the tympanic pyramid. Then if you go above the ice cream cone, you will see just air in the middle ear cavity. And this is what we call the epitympanum, where the middle ear cavity is separated from the brain by this bony ridge, which is known as the tegmen tympani. Then in this section, you can see the tegmen tympani, and you can see the epitympanum, which is part of the middle ear cavity, just only filled with air. Then if you look to the whole anatomy of the middle ear, you start by the level of the ice cream cone. And you see the head of the malleus, the body and the shorter process of the incus, the oncodomalleal joint, the middle ear cavity, adductus ad antrum, mastoid air cells. Then if you go below this level, you will see the connection to the nasopharynx through the Eustachian tube. You will see the handle of the malleus and the longer process of the incus. You will see the sinus tympani, which is the site for sinus cholesteatoma. And you will see the facial recess, which is one of the areas where the facial nerve go inside the Petrous bone. And you can see the tympanic pyramid. If you go above the level of the ice cream cone, you will see only air in the epitympanum, and this epitympanum is separated from the brain by the tegmen tympani. Then this is the anatomy of the middle ear. Then we came to the anatomy of the inner ear. The inner ear, there is the vestibule. There are 3 semicircular canals: the cochlea, the internal auditory canal, the cochlear aqueduct, and the vestibular aqueduct. Then we should have also an anatomic landmark, like the ice cream cone seen in the middle ear. And this anatomic landmark is the lateral semicircular canal. Actually, you know, we have 3 semicircular canals: the lateral or the horizontal one, the superior one, and the posterior one. Then the lateral semicircular canal, because of its horizontal position, it is cut and appear totally in the section. Then you can use it as an anatomic landmark. And if you adjust the angle of examination accurately, you will see the anatomic landmark of the middle ear at the same level of the anatomic landmark of the inner ear, which is the lateral semicircular canal. And you can see this is the lateral semicircular canal. Actually, you know, you see the semicircular canals via the fluid inside the canal itself. Then you know that these are the 3 semicircular canals. This is the vestibule and this is the cochlea. The lateral semicircular canal opens into the vestibule. Then if this is the lateral semicircular canal, this one should be the vestibule. Then part of the posterior semicircular canal can be seen at the same section. And here you can see this dot and this dot and this small line, which represents part of the posterior semicircular canal. Then at the anatomic landmark of the inner ear, which is the lateral semicircular canal, you can see 3 structures: the lateral semicircular canal, the vestibule, and part of the posterior semicircular canal. Okay, then this is once more the anatomy. Here is the lateral semicircular canal, which is almost seen at the same level of the ice cream cone. And this is the vestibule, and these 2 dots represent part of the posterior semicircular canal. In this cadaveric section, you can easily identify the lateral semicircular canal, the vestibule, and part of the posterior semicircular canal at the same level of the ice cream cone. Then, in this level, you can see the 3 structures: the lateral semicircular canal, the posterior semicircular canal represented by these two dots, and the vestibule. These are the three structures seen here. Then, if you would like to see the whole structure in a 3D configuration, you can obtain this image by either CT or MRI, where you can see the vestibule and the cochlea as well as the semicircular canals. But if you look here, you can see the ice cream cone, the middle ear cavity, adductus ad antrum, mastoid antrum, lateral semicircular canal, vestibule, and part of the posterior semicircular canal. Then, let us look at this section. Can you see the middle ear cavity? Yes, this is the middle ear cavity. Can you see the ice cream cone? Yes. Can you see the mastoid? Yes. Can you see the lateral semicircular canal? Of course. Can you see the posterior semicircular canal? Yes. Can you see the internodentary canal? Yes, this is the internodentary canal, and this is the vestibule. Then, let us look at this section. Then, if I asked you about this structure, what you can say? Yes, posterior semicircular canal, and this, and this, and this. Yes, which part of the ice cream cone? The head of the malleus, and this, the incus and the short process, and the ancodomallear joint in between. Very good. Then what happens if we want to see the superior semicircular canal? We should go up. If you go upward, you can cut the superior semicircular canal at its foot plates or at its crura. Then in another section, you cut the dome. Then if you cut the crura, you will see two dots like this. You see the dots, and these dots represents the crura of the superior semicircular canal. If you want to see, these are the crura of the semicircular canal, the superior. If you want to see the top or the dome of the superior semicircular canal, you go further up, then you will see a line. Two dots inferiorly and a single line superiorly, and this represents the superior semicircular canal. Then if you look here in this well-nomatized mastoid, you can see a line, and this line represents the dome of the superior semicircular canal. Then this drawing is just presented to assess the relation of the cochlea to our landmark, which is the lateral semicircular canal. These are the semicircular canals, and this is the lateral semicircular canal, and this is the cochlea. And what do you think about the relation of the cochlea to the lateral semicircular canal? The cochlea is inferior. Then if you want to see the cochlea, you put your finger on the anatomic landmark, which is the lateral semicircular canal, and go down. Then if you look here, where is the lateral semicircular canal? This is the lateral semicircular canal, this is the vestibule, and this is the posterior semicircular canal. If you are going to see any part of the cochlea at the level of the lateral semicircular canal, it will be the dome of the cochlea. Then the dome of the cochlea will be seen at this level, and here is the dome of the cochlea. And the dome of the cochlea is usually connected to the internodentary canal by a very short track, which is the canal for the cochlear nerve. You know that the vestibulocochlear nerve comes from the brainstem and goes inside the internodentary canal. The cochlear division pierces the wall of the internodentary canal to go to the cochlea. And here is the cochlear nerve, the canal for the cochlear nerve. And this is the dome of the cochlea. Then, if you look to this section, and this is our anatomic landmark, which is the lateral semicircular canal, the vestibule, the posterior semicircular canal, and this is the dome of the cochlea, and this is the canal for the cochlear nerve. Then what happens if you want to look at the other parts of the cochlea? You should go down. Then here, this is the lateral semicircular canal, this is the vestibule, posterior semicircular canal, dome of the cochlea. Then if you go down, you will cut inferior. Then inferiorly, you will see 1.5 turns of the cochlea, and this is 1.5 turns of the cochlea. It is almost similar to the dish with the food inside. You can see this is 1.5 turns of the cochlea. If you go more down, you will see the basal turn of the cochlea, and here is the basal turn of the cochlea. And you can see this worm-like appearance. This is the basal turn of the cochlea, which ends by a dot of air. And this air is located at the niche of the round window. And you remember the oval window at the footplate of the stapes, and here is the round window which connects the middle ear cavity by the cochlea. This is actually its actual location. Then, if I asked you about this structure, you will say the dome of the cochlea, and this is the vestibule, and this is lateral semicircular canal, and this is which part of the cochlea? 1.5 turns of the cochlea. Then, if you look to this section and I asked you about this structure, you will say this is the basal turn of the cochlea, and this the niche of the round window. And you remember this is the sinus tympani, and this is the tympanic pyramid, and this is the facial recess. Okay. Then this arrow points to the niche of the round window. Then what about the cochlear aqueduct? The cochlear aqueduct is just similar to the internal auditory canal, but smaller and at a lower level. Then where is the internal auditory canal? This is the internal auditory canal. Where is the cochlear aqueduct? This is the cochlear aqueduct. It's inferior and smaller. This is the cochlear aqueduct, the site of it, which is almost similar to the internal auditory canal, but is smaller in size and inferior in location. Then where is the vestibular aqueduct? The vestibular aqueduct is located posterior to the posterior semicircular canal. Then here you can see this is the vestibule, and this is the lateral semicircular canal, and this is the posterior semicircular canal, and this very fine track is the vestibular aqueduct. Normally it is 1 millimeter in diameter, 1 to 2 millimeter in diameter. But if this track or this aqueduct is markedly widened like this, this is what we call the vestibular aqueduct syndrome, which is one of the common sensory neural hearing loss in patients. Then if you look to the anatomy, you can see this is the vestibule, this is the lateral semicircular canal, these top dots represents the posterior semicircular canal, and this is the vestibular aqueduct, and this is the internal auditory canal. Then you remember that the jugular bulb, which is intimately related to the middle ear cavity, may be dehiscent and may not. The dehiscent jugular bulb means that there is no bony ridge separating the jugular bulb from the middle ear cavity. This is known as dehiscent jugular bulb. The non-dehiscent jugular bulb, you can see a bony ridge separating the jugular bulb from the middle ear cavity. Then finally, about the course of the facial nerve inside the petrous bone. You know that the facial nerve comes from the brainstem and enters into the internal auditory canal, then exits the internal auditory canal through the facial nerve canal, which is like the inverted V. If you look here, this is the facial nerve canal. It goes up to this particular point, which is the ganglion of the facial nerve, which is known as the geniculate ganglion. Then it descends down, then it passes below the lateral semicircular canal, then go to the facial recess after that. In order to see the facial nerve below the lateral semicircular canal, you should have the coronal image. But in the axial image, you see only the horizontal part of the facial nerve, which is the ascending limb, which is known as the tympanic segment, and the descending, this is the labyrinthine segment, and this is the tympanic segment. The segment which is near to the middle ear is known as the tympanic segment. The segment which is near to the inner ear is known as the labyrinthine segment. And if you look carefully to this drawing, you can see exactly similar finding. This is the facial nerve going into the internal canal, ascending limb, geniculate ganglion, and the descending limb passes below the lateral semicircular canal. Then, this is the ascending limb or the labyrinthine segment. This is the descending limb or the tympanic segment, and this is the geniculate ganglion. This is the vestibule, lateral semicircular canal, posterior semicircular canal, and vestibular aqueduct. Then, in order to see the nerves inside the internodontic canal, you should have an MRI, especially the T2 weighted image. Then, if you look here, this is the internodontic canal, and these are two nerves inside the internodontic canal. One of them should be the cochlear nerve, and one of them should be the vestibular nerve. And the cochlear nerve will pass through the cochlear nerve duct to enter into the dome of the cochlea. But actually, if you look inside the internodontic canal, there are 4 nerves, not only 2. The 4 nerves are the 2 divisions of the vestibular nerve, which are the superior and the inferior one, and the facial nerve and the cochlear nerve. There are four nerves inside the internodontic canal. In order to see the 4 nerves, you should have a sagittal section and the T2 weighted image. Then you see the CSF is bright, and you see the nerves as small dots which are gray in color. Then the 2 nerves which are close to each other are the 2 divisions of the vestibular nerve. The 2 nerves which are away from each other, the superior one is the 7th, the inferior one is the cochlear nerve. Then, actually you all know the difference between the CT and the MRI. And what is the value of the coronal images? We usually do routine coronal CT and MRI of the Petrous bone for only 3 main values. Number 1, to see the tegmen tympani. You know that the tegmen tympani is the bony ridge separating the middle ear cavity from the brain. And because of the Petrous bone is like the pyramid, it has an anterior tegmen and a superior tegmen. The anterior tegmen is seen in the axial, and the superior tegmen is seen in the coronal image. Then this is the superior tegmen. Number 2 is the oval window. And the oval window is the connection between the vestibule and the middle ear cavity. And if you look carefully to this opening, and this represents the oval window, which is better evaluated in the coronal images rather than to be evaluated in the axial images. Number 3 is the facial nerve, while crossing below the lateral semicircular canal. And if you see, this is the internodontic canal, and this is the vestibule. This is the superior semicircular canal, and this is the lateral semicircular canal. Then if you look carefully to this very small dot, I am pointing to it now, this is the facial nerve crossing below the lateral semicircular canal. This is the only difficult part which can be seen in the coronal, and you can also see the vertical part of the facial nerve while coming outside the cranium through the stylomastoid frame. This arrow points to the oval window, and this arrow points to the facial nerve crossing below the lateral semicircular canal. Then the final course of the facial nerve is the vertical one between the mastoid and the styloid process through the stylomastoid framing, can be easily also identified in the coronal image. That if you look to this image, you can see this characteristic configuration which represents the cochlea. Above the cochlea there are 2 dots, and these 2 dots represents the 2 limbs or the 2 segments of the facial nerve. The tympanic one is adjacent to the middle ear cavity. The labyrinthine one is adjacent to the inner ear structures. Then these are two dots, which may be referred to in the books as the snake eyes. This is the tympanic segment, and this is the labyrinthine segment of the facial nerve. Then the course of the facial nerve inside the Petrous bone starts from the brainstem, entering the internodontic canal, exits through the 2 segments up to the geniculate ganglion. Then the descending limb passes below the lateral semicircular canal, then go to the facial recess, then comes vertical to exit through the stylomastoid frame. Then there are some vessels at the cerebellopontine angle, and this is one of the famous vessels that may cross at the opening of the internodontic canal, which is the anterior inferior cerebellar artery. And if it is seen especially by MRI, this is an air cysternography, which is now an obsolete technique, but it can be easily identified by MRI. Then you should raise the attention of the clinician to the abnormal course of this artery at the orifice of the internity canal. Then by this we can finish the anatomy of the Petrous bone, and we came to the questions. Then you will see some arrows pointing to the anatomic structures, and you are invited to answer. Okay. Okay. Lateral semicircular canal. Head of the malleus. Body of the incus and the short process. Yes, this is the nucleate ganglion. This is the facial nerve, and you see the inverted V configuration. Internodity canal. Basal turn of the cochlea. Eustachian tube. Cochlear aqueduct. Very good. Cochlear aqueduct. Superior semicircular canal. Yes, labyrinthine segment of the facial nerve. Thamanic segment of the facial nerve. Cochlea. Vertical part of the facial nerve. One and a half turns of the cochlea. Very good. Vestibular aqueduct looks posteriorly. This cochlear aqueduct is just like the internodity canal but inferior and smaller. This is the cochlear aqueduct. What do you think about this? Facial recess. Okay. Head of the malleus. Incus. Geniculate ganglion. Very good. Vestibule. Yes, the handle of the malleus. Very good, the handle of the malleus. Longer process of the incus. 1.5 turns of the cochlea. Oval window. Lateral semicircular canal. Superior semicircular canal. Internoditary canal. Vestibule. Very good. Thank you very much.